Hi everyone. Okay, let's talk today about some tips for abdomen exam and lungs. Okay, with the abdominal exam, you'll notice that you start with inspection and then auscultation before you start palpation, etc. And that's just because you can change the bowel sounds that are present, or you'll get an inaccurate view of those bowel sounds if you start palpating ahead of time. So you have to listen for a very long time, sometimes much longer than you think, to really ascertain whether or not the bowel sounds are present. So, for example, if you have, you might listen to up to a minute in some places, in some circumstances. So don't be alarmed with that. And in other circumstances, you barely put the stethoscope onto the abdomen before you hear the bowel sounds. So the other thing is when you palpate. If a client has an acute abdomen or a problem, you do not have to press hard. They will be in pain and you'll know it. So be conscious of that. If they've come in with an issue, then follow through with the assessment in a very conscious manner, in the way that you're making sure that you're not pressing on all the areas in too hard, because you'll find what you need without pounding away on their abdomen. There are, you will find, several different maneuvers, if you will, for finding things like the liver. We teach you one, but there are a few really good ones and really interesting ones that you might want to look up. One in particular I like is the scratch test, where you put the stethoscope over the lower edge of the ribs on the costal margin, and then you gently scratch the skin below the costal margin moving up, and you can hear a difference when you hit the borders of the liver. Okay, so for lungs, the cardinal rule is listen for the entire time that the person is breathing. So the full inhalation and the full exhalation. That's a problem that a lot of people tend to forget to do. You will not necessarily hear abnormal sounds when you're doing the assessment, because these are typically young, healthy people that you'll use as your models, and you're only demonstrating what you know. But when you're actually doing it in the clinical setting, you're going to hear a range of things, and be conscious of that as well, and listen for differences. And also be conscious of the fact that it's sometimes difficult to hear airway in the bases, which is why you have to listen to so many different areas along the posterior of the thorax in this exam, but also in reality, you're going to listen to the bases, because that's where a lot of consolidation can happen and where pneumonias can happen. So be really conscious of that. And don't dismiss percussion as a tool. It's an excellent tool for identifying the differences between a consolidation and good airway. But it is a skill as well. So it takes a lot of practice, and I encourage you to do so outside of this, so that you become really proficient. Okay, we're moving along. And I hope that things are going well with your studying. Don't forget to ask any questions on our question form.